Hey guys, and welcome to this video. Now today we will be reacting to some health stuff. Things about patients, medicine, everything. Nobody, medical dramas. So apparently they're talking about medical drama shows. We already know how these shows go, so let's see how they're gonna react this scene here.
Okay, I'm making an incision into the patella affricato plate. Wow, that's beautiful work.
Okay.
Doctor.
That is true indeed, yeah, that is true. Like whenever you see these medical shows, they always like to compliment the surgeon. Whatever the surgeon is doing, they always love complimenting the surgeon every single time.
Thank you. Her stats are statting! What are her stats? Stat over stat. Okay, code
What are our stats? Stat over stat. Code blue, everyone.
blue, everyone. I need a stat triangle hematoma stat. Doctor, no, she's bleeding out. Her heart can't handle it. No, my heart. My heart can't handle what you did to me last night.
That is true, guys. That is true. These people are saying the exact same thing. What I normally observe in these medical dramas here. They're in the middle of a serious operation, and yet still you hear them talking about different drama. If it's relationship drama, drama in their homes, drama at work, whatever the case may be, they're always talking about some drama in the middle of a very important surgery every single time. I don't know why they do it, but I don't know how they focus as well too. It's very strange in my opinion. But I guess some people can multitask. I just hope this patient here doesn't die.
You know, I opened up to you. We laughed together, we cried together, we even slept together in the oncology pediatric ER/OR ICU room. And when I needed you most, you bailed.
That's
Doctor,
weird, man.
no, it's too late. Whatever you say, it won't work.
She's
I've
dead.
moved on. Doctor, no, the patient's moved on. She's dead. What? Oh.
Horrible, man. Guys, it's horrible. It happens though.
Crack.
Well, I don't know if it doesn't happen in real life as far as I know, but it happens in these dramas, yeah. Wow! Wow, man! What is that? I don't know what they're trying to do there. I think it's some sort of like these viral videos. I normally see these viral videos of chiropractor, all these things. I see them over and over again all over social media. So I'm guessing it's something to do with that.
Wow.
No way, man. No way. Literally, it looks the same, you know. It looks the same. Like, it does look like this is actually very possible with how they do these massages and bone cracking and so. It looks like it's very possible to see something like this.
Oh, doctor. Qué lindo me quedó la carita. Puedo respirar mejor.
You're a doctor delivering bad news, but it's also your birthday. Oh, let's see what's up here.
There's good news and bad news. Bad news is his retinas are fried. He may never see again.
What does he have on his mouth there, man? Like, was he eating cake or something?
Oh, God.
But even cake too, like, why is his mouth so messy? That's a bit strange.
God. What's the good news?
It's my birthday.
No, you don't see doctors doing that. You don't see anyone doing that, actually. Like, I've never heard of a situation where a doctor would say that. Let's go, man. Let's go. I don't know, like sometimes it's possible that these kind of things can happen. What would normally happen is they would finish off the urgent situation and then they would hand over the case to the upcoming doctor. So whoever is in charge to take over the shift from the doctor who was there, they're going to take over and they're going to continue looking after the patient, caring for the patient. So normally, when it's a critical condition, the doctor finishes off the work and then they leave. They don't just leave in the middle of a critical condition when the patient is about to die. I see the girl was pointing to herself. Well, the girl was pointing to someone else because death was coming to her. But she was saying, no, I'm not me, I'm alive. Look at the patient, that's the one you go after. Dr. Snowpest.
Hello, doctor. I've been having trouble with my eyes.
Well, looks like you've been watching too much porn on the internet, I'm afraid.
Are you sure?
Yes.
I wonder how he knows, you know. I wonder how he knows.
Good news, and I've got some bad news. Which would you like to hear first?
Good
Tell me the
news.
good news. The good news is I got you some flowers. Aw.
Not really that good of a news, but it's something, yeah.
Aw. Thank you so much. The bad news is those are for your funeral.
Yeah, of course, guys, we would never see something like that in real life. It's just comedy, of course. But imagine hearing that, though. That would be funny. Of course, not for the person who's hearing it.
Your checkup is completely clean. You're in perfect health. Great. The last question I have for you is whether or not you'd like to be an organ donor.
What would that entail?
You know, and when you die, maybe we would harvest your organs and give them to a little girl who's been in a car accident, or maybe a mother who went through a complicated pregnancy. Perhaps give them to a doctor who needs to finish his monster.
What was that?
A little girl in need.
He sounds like he's regretting it. Like, I don't know, he's that little girl has given him a lot of trauma. That's how it sounds like. But usually you don't really find, well, I've never really experienced a situation where a doctor goes up to a patient after treating them and then saying, okay, do you want to be an organ donor? That's usually not how it goes. I've never experienced something happening like that.
Doctor, how's my husband?
I'm sorry, we had to cut his.
The doctor full of surprises. So this is a doctor here full of surprises. I'm sorry we had to cut his right leg.
Right leg.
What?
Yes, his right leg is. I'm just joking. We actually cut his left one.
What?
Why are you joking like that though? Like, trust me, if you're to joke like that, you're gonna get fired. In a real situation here, there's no way you can be joking like that. No way.
Yes.
But the pain was in his right leg.
I know the pain was in right one, but the right one when we were cutting it, it was paining so much that he was like, ah, and we could.
Obviously, it'll be paining, man. Like, if someone's cutting your legs, obviously, you're gonna feel some pain, right?
And cut the right one, for God's sake. We are also doctors, we are humans, we couldn't do it. But the left one was fresh. No pain. We had to cut one, so we cut the left one.
What?
Yes. I'm just joking, both the legs are fine.
He's joking. Of course, he's joking.
Okay? I just wanted to talk to you about his kidneys.
What happened to his kidneys?
In the
He's joking.
operation, suddenly his kidneys started functioning like kidneys, which is normal for a kidney to function like a kidney. Kidney functioning like a kidney. That means kidney is normal. Yeah, all good. Why are you being so negative? It's all good. It's all good, okay?
He just told the woman a bunch of things, and now he's saying it's all good.
Okay, just collect his body from second floor, okay?
His body?
Yes.
His body?
Yes, your husband's body is on second floor. The body is sitting on a sofa waiting for you. Body is happy, breathing, laughing. You know, body was
He's
hungry some
joking
time
now.
ago, so we gave body.
You
to
wanted
eat
her
something,
to
body
think
right
that he
now is eating
died.
like yum yum. Okay, it's all good. Okay, perfect. Okay,
Doctor, theater is ready.
theater is ready. Okay, theater is ready. Oh, which movie?
Doctor, operation theater.
Operation theater. Okay, action movie. Okay, go. I'll come. Okay, perfect.
Yeah, me personally, I don't want this guy to be operating on me with that kind of attitude, sarcasm, humor, and everything. No, it's too much.
Thank you, doctor.
Most welcome.
I can't wait to hold his hand.
Perfect. Sorry,
I can't wait to hold his hand.
you wanted to hold his hand?
Yes, of course.
You were supposed to tell me earlier.
Another joke.
Yes. Good one.
Or he's serious. No, he's actually serious.
Thank you. Bye bye. So insensitive.
Go buy this. I'm here for this. This is exactly how it is, guys. Trust me. Of course, this here is a bit of an exaggeration there because usually you can understand what doctors are writing. Like the doctors I'm around, usually you can understand what they're writing. But there are many of them also that write like that. I don't know how in the world people can read or understand that. That's strange in my opinion. And the pharmacist, of course, it's always the pharmacist that understands every single handwriting. I don't know what they do or how they do it, but it's very impressive. The hospital doctor's mistake.
Hey, is everything okay?
Yeah, everything's fine. The doctor is behind me with more details.
Okay, thank you.
Let's see here. Oh, right. Hey, so you are the son, correct?
Yes, I am.
Oh, his? Okay. So everything went fine with the surgery. We had no complications.
Surgery for what?
Well, he needed to have his leg amputated.
What?
Correct?
No, we brought him in here because he had a migraine.
Well, guys, you already know what that means. That's a lawsuit coming up right for these people here. And it's not going to be pretty at all.
I'm sure that was a
It
mistake.
was a mistake. Clarify, because your life depends on it. Your actual career depends on it.
His name was Mr. Smith, right?
Yeah.
Smith? Okay.
Yeah.
Let's see here. Mr. Thompson.
He knows he cooked. He knows he's cooked right now, literally.
Mr. George.
Somebody needs to tell me what the hell is going on.
Yeah, no, I'm pretty sure. Just calm down. I'm pretty sure everything will be fine. We'll get this.
You just told him about surgery when his son came in for a migraine. I doubt it's gonna be possible to calm down.
Figured out. Hey, do me a favor. Can you hold this for me real quick, nurse?
Run, bro.
Where's he going?
I'm sure he'll be back soon.
Okay.
Yeah.
Like never worry.
Oh my God, is that a roach?
What?
Gone. When you see the surgeon and it's your friend who uses ChatGPT to pass his exams, bro. Yeah, 100%, guys. 100%. I'm running, man. I'm taking everything. I said cancel everything. Cancel everything. I don't want to be a part of this. Of course, this is not actually how it happens because you do see your surgeon before the operation starts. But yeah, if you're to see someone who uses ChatGPT to pass your exams, you're gonna have to run. ChatGPT is helpful, but not as a way to pass exams. It's helpful to prepare for exams because you can find a lot of information on ChatGPT. Even me, like when I'm studying for my exams, I find a lot of information from ChatGPT. I use my textbooks and everything else, and I just combine it.
Relax, nephew.
That's funny. Okay, same one here again. When your friends graduate med student with ChatGPT and now they're your doctor.
Relax. Chill.
What is Snoop Dogg doing here, man?
Wait, what's that?
The dude is dying.
Just turn that up.
What's happening? Tachycardia? No, not tachycardia. Whoa. This is the error here because on the screen it's showing 74 beats per minute, which is normal. So, but the sound is like tachycardia, so I don't know. And tachycardia is when your heart beats faster. So I don't know what's happening there. That's a bit of an error of the video, but it's still funny though.
Have the car, please.
Okay, it's rising there. I just heard rising there, 86, from 74 to 86.
More smoke.
More smoke. Yeah, this guy is not waking up from the operating table there. I'm pretty sure. He's dead. He's gonna die. They're dancing. What in the world is happening here, man? This is not just ChatGPT. This is craziness, man. This is not just ChatGPT. What's 50 Cent doing here as well?
Alright, sir. So
Another
you're here to get your
ChatGPT
wisdom teeth
video.
taken out?
What? No, I'm here for heart surgery. Was that on my files?
There's no way they can mess that up, man. Wisdom teeth and heart surgery. Like, how can I mix the two up? That's two different things.
Oh, silly me. So, why exactly do you need heart surgery?
What kind of dog, guys? If you see a doctor asking you that kind of question, where you're now about to do heart surgery, run. You're better off just surviving by yourself because you're gonna down the table there 100%. I'm pretty sure.
I had a heart attack recently and the doctors recommended me heart surgery.
Oh, okay.
But you don't get heart surgery just because of a heart attack. It depends on the severity and on many other factors as well. You have to look into if there's heart failure or anything like that. Anyway.
Yeah, I got you. So, I'll be right back with the tools and we'll start the procedure right away.
Thanks, Doc.
I'm surprised he's still confident there.
So, this is all we need for the procedure,
Yep.
right?
Yes, now it's time to run. You have to run. There's no other option.
What?
What seems to be the problem, sir?
Why y'all need
What seems to be the problem, sir? You're gonna kill me, sir?
a hammer and a drill?
Well, we do need to get through your rib cage, right?
Yeah, I think so.
Y'all aren't sure?
I think so.
Get me out of this.
What kind of surgeons,
Hey, you've
bro?
already been charged. You might as well just stay.
What?
Yes, just calm down. We're gonna make
What
some
kind of
last minute
surgeons are
preparations for
these,
the procedure,
man?
Right?
Man, you got me fucked up! Man, y'all tripping in this bitch, man. I didn't give y'all permission to charge me yet!
Before we talk about this procedure,
These guys are checking our video on how to do the. These guys are checking a video on how to do the procedure. That's extremely strange, man. Imagine seeing your doctor. You're about to do a surgery, and he's checking a YouTube video on how to do the surgery. There's no way you're gonna be confident in that.
Let's review some information about your procedure.
Are y'all watching a tutorial on this?
So we just need to make an incision in the middle.
Whoa! Should you put me to sleep
I'm even
first?
crying now.
Oh yeah, we were about to get to that part.
I'm even crying now, guys.
We just need to.
Yeah! Anesthesia right there. You don't need anything else.
You sleep now, huh? Yeah. Put his ass up now.
Guys, he's gonna be fired. 100% lawsuit. He's gonna be put in jail actually.
Yes, sir.
Off-pump cabbage procedure. Before we talk about
Doctors don't actually save your life. They just extend it for a longer time. Isn't that concerning?
Hello, doc.
That's not actually true. There are many cases. Like, I don't even have to go into it, but there are many conditions that doctors treat and cure. Literally. Of course, there are some cases where they just try to manage you and extend your life, like heart failure, COPD, or something like that. But when it comes to actual things they can treat and cure, they treat and they cure it. So yeah.
Doctor, I think I broke my wrist. Hello, my dear. What happened? I don't know. I fell from the tree as I was trying to get the cat down. Why don't you sit down? Let's take a look at that, shall we? Alright, go. Down. Okay, alright, well, careful, please. Alright, I'm ready for you.
Careful.
Alright, if I touch here on a scale of 1 to 10, how painful is it? I don't know, 10, 20? I don't know, it really hurts. Well, you know what? You'll be just fine. Why don't you just go home and put some ice on this little bad boy? And if you feel like heat will help, just do that as well. And if the pain persists, just so you can take some painkillers and you'll be good to go. Alright, have a good one.
Not really the best advice. Like, she needs to check and see if the wrist is broken, like if there's some sort of structural damage. Because when there's pain, you always have to assume that there's a possibility of a fracture. And once there are fractures can also destroy vessels and nerves as well. So fractures sometimes can be simple, can be easy to solve, but it can also be serious as well. So she should take her due diligence and check the patient properly, check to see if she can move her wrist properly and everything. Or if not move, at least order an x-ray or something to see if there's some sort of structural damage. 2 weeks later, what's this? $6,486 for what, bro? Well, guys, that's the end of the video. I did enjoy reacting to these TikToks here. If you want me to react to more TikToks, just let me know. And if you want, you can even send me some TikToks to react to as well to my next video. But yeah, guys, that's it from me. If you do want to find out how this guy was able to live over 100 days without a human heart, then check this video out here. Anyway, guys, thanks for stopping by. Leave a like if you enjoyed the video and subscribe to see more health and wellness videos like this. I'll see you in the next one. Peace.